Hi folks, today we talk about another category of medications that have become really cornerstone drugs in heart failure therapy, and you might indeed wonder why, because these drugs were discovered as diabetic medications and as a quirky bonus help in heart failure. So what are these drugs? Why should we be on them? Obviously, this is an individual decision for everyone who has heart failure and their doctors to decide. But let me tell you about them nonetheless. So this category is called the SGLT2 inhibitors. These are sodium glucose cotransport 2 inhibitors. You may have heard the names like empagliflozin, which is Jardiance, dapagliflozin for Forxiga. In other countries, they also have canagliflozin, ertugliflozin, and sotagliflozin. And I'm sure there'll be more of these down the track. These got added to the heart failure guidelines in 2021 for management of heart failure, because even though they are medications for diabetes and they work by releasing glucose in your urine, they also, in a way that we're not entirely sure why, have benefits for patients with heart failure, even if they don't have diabetes. So they reduced heart failure hospitalizations and cardiovascular death in the trials. These got added to the ESC guidelines in 2021, and they came along and on top of the other main heart failure medications which we've already talked about. So these drugs can be given in small doses to benefit heart failure patients. We're not trying necessarily to reduce your blood sugar levels. But obviously, if you have diabetes, your endocrinologist may have already put you on this medication in order to help both conditions. So there are a few things that you need to watch out for with these medications. Hypoglycemia or low blood sugar could be a problem. Sometimes lower blood pressure as a result. Worsening kidney function is important because these things are excreted by the kidneys, and they have a certain limit at which they might become more dangerous than others. Monitoring the blood tests is important in regards to that. There are a couple of things that we watch out for clinically when using these SGLT2 inhibitors. So one is if you are fasting for any reason, so say you just can't eat because you don't feel like it, say you are actually fasting, say you have a procedure where you can't eat for a number of hours, under those circumstances you should not take your SGLT2. It should be omitted for that period of time. Under the circumstances where you are ill or unwell, particularly if you have a gastrointestinal illness or something like that, you should also not take your medication. Check with your doctor. And then finally, if you're getting repeated fungal infections or repeated urinary tract infections, which can be a little bit increased with this medication, then again, check with your doctor. You probably shouldn't be on this drug. There are, of course, other potential side effects that the medication can have. One of the more serious effects is called ketoacidosis. If you're diabetic, you may even be already familiar with this condition. We don't recommend this drug for type 1 diabetics, only type 2 diabetics, because of that increased risk of ketoacidosis. This might present itself as nausea, thirst, vomiting, stomach pain, headache, fatigue, muscle aches, just feeling unwell. There are a number of ways that it might be presenting, and so if you've started this drug or you've been on this drug and you start feeling like that, that is really an important time to go see your doctor for help, or if your doctor is unavailable, perhaps you might need even to go to the emergency department. Excuse me. So it's important that you have some aware of this drug and mindfulness of certain scenarios where you maybe shouldn't be taking it, such as fasting, being unwell, or if you're having recurrent infections. But overall, this is an important addition to heart failure therapy, reducing hospitalisation for heart failure and cardiovascular death. So again, if this is right for you, that's to be decided by you and your doctor, but certainly something worth asking about. I do have a number of patients who are on this medication. Most of them have done very well with it. There's only been, I think, one incident so far where I've actually had to stop the drug in one of my patients. So generally it's pretty safe and it's pretty well tolerated. It's also useful in both HFpEF and HFrEF, so that's heart failure with reduced ejection fraction, heart failure with preserved ejection fraction, making it quite useful, particularly for those who have the preserved ejection fraction type of heart failure, because there are few drugs that have actually been shown to be of significant benefit in that group in terms of heart failure medications. So this is a welcome addition certainly for them as well. Anyway, in the next video, we'll be talking about a brand new cardiac inotrope, which is in oral form called vericiguat. So I'm kind of excited about this because it's been many years since the infusion forms of these drugs have been available, but they can only be given in high intensity circumstances in an ICU or a cardiac coronary care unit, and as an infusion they are only really primarily working during the time that we are using them. They can be extraordinarily useful. They're quite powerful and they have to obviously be very carefully monitored, but now we have the option of using an oral form of this, a tablet. So that's pretty exciting, and I'm going to tell you about that in the next video. I wish you all a very happy new year for 2024. I know having heart failure can be quite daunting, but I really want to assure you that with education you can feel more comfortable with what's going on and feel more empowered about how you approach your care, and obviously to seek the best that you can possibly get from both your doctors and the medical system and any supportive elements, whether that's cardiac rehab units or the like. But it's definitely a team approach to getting great outcomes, and that also includes you and your efforts, and that's particularly what I want to be able to do here, is share with you how you can actually help yourself. So if you also have any queries or if you have any topics that you would like covered, then please let me know in the chat below. And if you find this information helpful, please subscribe so that we can get more education out there and let more people know about this. Thank you. Happy New Year, and I'll see you on the next one.